Hello, good afternoon. I'm Dr. Sukhbir Singh this side. I'll be discussing with you an interesting case study of fat grafting under local anesthesia. Here's a young female who has got cheeks which are sunken, both sides. As you can see in the marking, I've already illustrated. We plan a fat grafting for this young girl who's about 25 years old. We'll be taking out fat from the abdomen, and then through using microcannulas we'll be injecting in the predefined marking areas just to give a equal cheeks both sides and to improve the sunkenness.
So does it have any side effects post surgery?
Fat grafting is a very common procedure which is done, and because we are using the patient's own autologous fat, chances of any reaction or foreign body reaction or anything is very less. Obviously, it's a facial procedure, so definitely she'll have a bit of swelling post-operatively, but it will subside in a couple of days. We always over-inject fat, that is about 20 to 30% extra, because we all know that fat gets reabsorbed up to the range of 20 to 30%. So we have to always put something extra so as to even out the absorption part.
So post surgery, will she be able to have food and all that?
Yeah, she can have a food. She'll have a restricted diet for around 5 to 7 days, and after that she'll be on normal diet after 7 days.
What would be the healing time, sir, generally?
Normally after fat grafting she can go back to work within like 48 hours. She'll be back to work, and because it's autologous fat, so the body takes its own time to heal, and the end result is usually visible at the end of 3 months, after the fat reabsorption is occurred and all. But usually we'll see the result immediately post surgery, which I'll demonstrate while doing surgery. We'll compare both sides. We'll do one side and then I'll show you both sides compared, and then after the end of the procedure we'll again show you the markings and the finishing point.
And what age group are most suitable to do this?
Actually, there is no defined age group. It's a very safe procedure. Anyone between 18 to even 60 years can undergo fat grafting. It all depends what is the etiology of it and what is the indication for which we are doing the fat grafting. Otherwise, it is very safe procedure. There are hardly any side effects in this procedure.
And do they have to undergo any tests before the surgery?
Just routine blood tests, obviously, for everybody, as indicated, a complete blood count and a coagulation profile. And obviously, the viral markers have to be done because it's the basis of any surgery.
And for post-surgery, sir, does she have to undergo a course of medication?
A normal antibiotic and all, 5 to 7 days, a bit of anti-inflammatories so that she doesn't have too much of swelling. But patients do not require any painkillers more than 24 to 48 hours. That's the maximum duration of painkillers.
So you will be taking the fat from the abdomen,
Yeah.
and
Yes.
so will she have any problem with the stomach?
No, stomach obviously we are taking out, so it's always good, no? She'll have a reduction in the stomach size, and they will be using that extra fat in the abdomen to the face. It's always a better option.
Okay. And the stomach will also heal faster?
Yeah, because we are going to take out very less quantity of fat. We are not going to take out some 100 200 ml or even more than that. We are just going to take out just a couple of cc's, that's all.
Hi, very good afternoon once again. We are here again to show you the fat grafting procedure. We will be starting with the local anesthesia injection. I am giving you a local injection, okay? Okay, I am giving a local injection at the site and I am infiltrating. After the injection is over, we are going to make a small neck with 11 number blade. Ma, you have to fill this and give it to me, okay? Using the infiltration cannula, which is right here, we'll be infiltrating. Please lose it, ma.
Sir, I'm taking this one, no?
Yes, ma. We'll be infiltrating the predetermined area, that is the periumbilical area and the lower abdomen, for harvesting the fat. I'm just tunneling it.
By tension table badaita.
Yes, as you can see, I'm tunneling. I'm giving the tumescent solution, which is a standard solution. It is comprised of 1 liter of ringer lactate with 30 ml plain xalocaine, 1 ampule of ethylene, which should be fresh, should be pre-checked, and I always add 10 to 15 ml of soda bicarb, as this procedure is being done under local anesthesia. Soda bicarb basically helps to dilute the acidic pH of xalocaine, so that patient doesn't have any ting sensations and is pain free throughout the procedure. Don't make it tight, beta. Hey, loose. That's it. Enough. Relax. Give me local. Revati, just relax, bacha. I'm injecting this so that swelling will come down when I come here. The infiltration is over. We have already waited for around 10 to 15 minutes. Now we'll be extracting fat. For fat grafting, I use only syringes. I don't use any power. I'll be using a 20 ml syringe in this case. It's connected to my cannula. It's a 3 mm cannula. I'll be tunneling it, creating a negative pressure. Once I've created a negative pressure, as you can see, just close up here, I'll be slowly gliding my cannula. And you can see the fat which is coming out. You can appreciate the yellow color of fat. It does not mix with any blood and all. The negative pressure which is created by the syringe is less than 1 atmosphere. It is very, very minimum, so as to reduce the injury to the adipose cells. We are slowly going through the pre-formed tunnels already and trying to collect fat in different syringes, which I'll be showing you subsequently. Pain to nahi hai? Okay, just relax. Why are you afraid? We've already collected fat, and as you can see, the yellowish yellow color of the fat with very minimal blood. And we'll make all the syringes 20 ml and 10 ml which I have collected in this stand, and we'll make them stand for about 30 minutes. And as you will see, after 30 minutes there is separation of fat in different layers, and subsequently we'll be removing the water and the RBC layer and using the fat for injection, which I'll be showing very subsequently to you. Waiting for our fat to get separated, we have already prepared the head end of the patient where we have to inject the fat. You can see my predetermined markings are already there. You can see it very well, the predetermined markings on the cheek. Okay, I have already given local injections block so that to make it numb. I'll be using 11 number blade now, just to make a small neck for my micro cannula to get inserted, which I'll be using for fat grafting. This is one side and this is for the other side. Now I'll be using my Coleman dissector. I'll be using my Coleman, this is called the Coleman V dissector. If you can see carefully, you can see it has got it's a V shaped in the end. This is for dissection. Okay, this is for dissection of the space where the fat has to be injected. I'll be inserting through the hole and going gently through the hole, pre-tunneling it in different layers where I have to inject the fat. You can see I am already tunneling it. My tunneling is over here. I am already on my marking. This side. I am coming all the way here. I have already reached here. It's very important to do the pre-tunneling and to break the adhesions. This V dissector helps to break all the adhesions which are present already and to create a good space for the fat to be injected. This is one side over, and then similarly on the other side we will be doing it. Again the V dissector will be going inside through the micro incision which I have made, and you can see it smoothly glides inside. It takes a bit of effort to remove to create a good space in different layers, and it has to go beyond. You can see it is beyond my marking, 1 millimeter beyond my marking. Similarly, I will be doing it in all the dimensions. Stop. क्या? Delhi? From the 20 ml syringe, we have transferred, after separating the fat from the fluid and the oil layer, we have transferred it using this fat transfer to the 2 ml syringe. You can see the yellow fat, no blood with RBC or any liquids is seen. This is pure fat, and we will be injecting this fat in the cheek area, which we have already shown. Stop. As you can see, I am transferring this fat from this 10 ml syringe to the 2 ml syringe with gentle pressure on the 10 ml. You can see the micro droplets of fat which are going into the 2 ml syringe. Pure fat, there is no liquid, nothing in this. Again using the micro fat cannula, this is the injector cannula. Again to show you, this was the V dissector, Coleman V dissector, which we have dissected. Now this is the fat injecting cannula. The best part of this cannula, if you see very closely, it has got a blunt tip. Just focus here please. Focus on this cannula. It has got a blunt tip so that it doesn't injure any tissue. this space, you'll see how easily the cannula goes inside. Just focus here, sir. See, it's already inside the tunnels which I have already made. Slowly I'll be injecting it and withdrawing. Again, pushing it inside and withdrawing. Pushing the fat inside. See, if you compare the right side of the cheek from the left side, the right side after injecting fat, just focus here, after injecting fat you can see the sunkenness has disappeared, it has become quite even, there are no depressions seen at the moment. You can compare this with the left side of the cheek which we have not injected till now, it is appearing sunken. You can compare again, this is the right side, this is the left side. I'll be showing a worm's eye view later on. No, there. No. इतनी जल्दी क्यों संडे है क्या just we'll wait for 10 minutes more, this will separate and we'll inject that from the side or the side. Just you can see in the worm's eye view, look like this, na? The cheeks appear quite filled up now. They're not the sunken cheeks which were seen previously. If you can appreciate well, the left side appears to be, it's already overfilled by about 30%. Right cheek needs a bit of more injection as compared to left cheek. If you compare, right cheeks need a bit more overfilling because we all know that fat absorption occurs to the tune of 20-30%. So we have to over inject a bit. So I'll be injecting about 1.5 ml, 1 to 1.5 ml more on the right side. Left side is almost done. You can really appreciate that. Stop. Lower incision now, the abdominal incision. One single stitch is more than enough to close it, and that's it. Is done. On the face, we'll be just putting tapes. We will not be putting any stitches because these are all micro cuts. If you can appreciate, the cut is hardly seen. This is the cut, that's it, both sides. So we'll not be putting any stitches. We'll just putting tapes, occlusion tapes for the dressing. After I finish injecting the right side, then I'll be using occlusive tapes for the both sides. I'll be showing that subsequently. Stop, sir. थोड़ी बहुत तो आएगी यार. Just see both sides now, it's equal, కొంచెం unequal. Thing is there on my face, ma. To help me. I think it's equal, ma. I'm ending the procedure, then they can talk whatever they want. Check, ma. Secret channel, ma. Check. Equal, unequal. Sulpa. Dekh bhai. The procedure, should I speak? This is the end. We have already, you can see, compare now. Left side of the cheek, right side of the cheek. The sunkenness is gone completely. They are over distended with extra fat, as I've already told. Because of the chances of absorption of fat, we have injected a bit extra, about 20-30% extra, both sides. The sunkenness has disappeared completely, and the normal cheek contour, the rounded contour, has been restored for this young female of 25 years. Thank you.
Can you see both sides? The inflated cheeks now. Both are hyperinflated about 20% to prevent the absorption. You can see from this side, the left side of the cheek, the right side of the cheek. All the sunkenness is gone. It's slightly over distended. We have not put any stitches. We have just used tapes to occlude it, and patient will be advised post-operatively not to massage or chew for a couple of hours, and then we'll slowly start on a liquid diet and then soft diet. You're comfortable, ma? Thank you.